Good evening and happy new year, and welcome to Couch Conversations with the Doctor, where wealth is health. And I'm really excited that we're here tonight. I'm always excited when it's a new year because it gives us a chance to pause, reflect, and maybe do things better than in the previous year. And I know a lot of you guys are so excited about the new year because you get a chance to have some New Year's resolutions and just do some things better, because as you know, if you take care of your body, you're going to be healthy. So I'll get started by saying I'm a family doc, obesity doc, nutrition, education, functional medicine education, all the things you need to heal. So let's go to our next panelist, which is Dr. Johnson. Could you introduce yourself to the audience tonight, Doc?
Ansel Johnson. Can you hear me now?
We got you. Go ahead.
Great. I'm Dr. Ansel Johnson. Please listen in because this is a great panel and this is such a big blessing for me. But I am an optometrist and all things concerning eyes, I'd like to say. I'm in private practice and we do a lot of ocular disease management, but we connect the dots between your eye health and your eyeglasses. So a lot of times people come in to get a new prescription for glasses, or they may be referred by their primary care physician or endocrinologist because that's diabetes is one of the leading causes of adult blindness, to get that checked out. But we like to address people early throughout in their lives and manage their eye wellness. So if they have hypertension, we look a little deeper. If they're pre-diabetic or borderline for diabetes, we look a little closer and we help counsel them. So we offer that counseling aspect. And again, we talk about nutrition, which this panel is all about. So again, we connect the dots between your eye health and your eyesight.
All right. Well, Doc, do me a favor, put in the back of your head, since I had Lasik in 2022, any comments that you may have about that. So we'll kind of circle back around to that question, and we'll go to our rheumatologist, Dr. Graham. What you got for us today?
Thank you, Tony. I'm a retired physician. I practiced rheumatology in the western suburbs of Chicago for about 30 years. Retired and spent 2 years in Washington, D.C. in the congressman's office. It's a real honor to be here. I just want to comment what Dr. Johnson said. And so many of our diseases don't have symptoms until they're far advanced. And looking into the eyes will really help you detect them early. Another one is glaucoma. So I just want to support what Dr. Johnson said, and I'll see if I can answer your other questions if I can.
Thank you, Doctor. And our celebrity doctor, Dr. Terry Mason. Why don't you introduce yourself? Oh, yeah, you got unmute yourself, my friend.
No celebrity. Just
always in our heart, in our heart and minds. You will always be a celebrity.
Just a servant. That's all.
That'll work.
And I'm glad to be here to serve. That's what the last more than 40 years of my life has been about. So I'm grateful to be here with my esteemed colleagues, and we hope to answer questions that you may have. And maybe we'll even have some topics that we'll talk about that will help educate you or unconfuse you on a particular point or two. So thank you for being here.
Thank you, Doctor. And Dr. Miller, why don't you introduce yourself as well?
Good evening, and thanks, Dr. Hampton. My name is Dr. James Miller. I'm also a retired physician. I practice mainly on the west side and west suburban area for about 40 years. I retired in 2019 from internal medicine, and I'm happy to be here tonight. As we're going into a new year, I think it's always, a beginning is always a time to start planning for the future. And actually, every day is the beginning of the rest of our lives. And I think that we can, whatever mistake that you made, whatever error you committed, you can't really often change those things. But you can, at the beginning, you can make plans for the future. And I think that when you're talking about your health, you really need to make the right plans and make the good choices to do better, whether it be your diet or whether it be just you're getting the proper rest. And being kind and being loving to one another. As a society, I think one of the things that really did hit home when the Mr. Hamlin, the football player, was injured last Monday, and the outpouring and the gathering and the support shows that when people come together on one accord, how we can, how it becomes a very powerful thing. And I just hopeful that as a world, as a nation, that we can start to come together on issues and try to resolve some stuff as opposed to just being at each other's throat. And at the end of the day, if we're divided, we all eventually will fall from that. But together we can stand and we can solve a lot of our issues. So hopefully, as we talk tonight, that what we give is hopefully will be information and things that are going to be helpful in terms of bringing people together, helping people to be more successful with their lives.
I agree. I'm not sure how much money they've raised, but just a few days ago it was like 4 or 5 million. So it's probably, who knows what it is now. And that tells you how powerful we can be if we come together and try to make a difference. And thankfully, I did see a post where he was doing better. So glad to see that. Dr. Maya, go ahead and introduce yourself.
Hello, everybody. I'm Dr. Migraine, always keeping it 100. Very excited to be here with the team and with this panel. Thankful to Nikki. Y'all hear my baby, my dog in the background. She ain't played with that squeaky thing all day. She gonna play with it right now. So very excited to learn from and with the community. Excited about the work we do. Want to get into some of the questions that the community has. And thank you for having me. Thanks to the Congressman, Danny K. Davis, and thanks to Nikki Harvey for organizing this at a time during the pandemic, the COVID pandemic, where we needed to come together and answer some questions. But then we found that it goes further than that and, beyond the pandemic. And, I don't know if we're beyond the pandemic because it's still out there. Y'all see the numbers. But our questions go to mental health and whole body health and spiritual health and things like that. So excited to talk about health and wellness in our community today.
Thank you, Dr. Maya. Love that smile, love that energy, and we appreciate you so much. And for those who are checking us out tonight, where's Dr. Pete? Well, Dr. Pete may show up tonight. He's running a little off, but Nikki and the Congressman are doing what they do. They're trying to get bills signed and things like that. So they may or may not be joining us tonight, but we wanted to keep the tradition going, particularly after missing a couple of weeks because of the holidays. And as you know, these are holidays that we have to honor and respect. I think we all needed that rest. And I do want to do a shout out to Nellie King for saying hi to us tonight on Facebook, and also a shout out to Connie Taylor. We appreciate you joining us tonight. And of course, Tia Banks, who's checking us out on YouTube. So we got an audience that's out here doing their thing. I'll kind of start us off a little bit just by explaining why I only got 3 hours of sleep last night. And I was fortunate to go to Costa Rica. But unfortunately, my airline did not agree with me. So by the time I got home, they were delayed and late, and it was not a good experience. So I didn't get home till 2 a.m. and had to wake up at, I think I went to bed at 3 and got up at 6. So I am, but this is something I really want to emphasize. And I'm not just saying this because I'm just feeling it, but I've had this happen over and over again. If you take care of your body, give it the right fuel, make sure you get exercise, try to get sleep when you can actually handle these moments when you're under a little stress. I went to clinic, saw patients, had a meeting before this meeting from 3 to 6:30, 4 to 6:30. And of course, we're going to spend some time with you guys tonight. So, but anyway, I just wanted to mention, now hold your breath, Dr. Mason, because I was in Costa Rica because there's a documentary called Reverse Carnivore, and I am going to be one of the clinicians who will add value to that conversation. That probably won't be coming out until the late summer, but basically a group of people who are trying to heal are attempting to do that with an animal-based diet. I just wanted to give you an example of why we have so much disconnect on nutrition science. And some of it is not just because the studies were poorly done, studies with surveys and things like that. Some of it is not understanding that your body is different with different dietary patterns. So let me give an example. So if you take a person who changes how they eat, your whole metabolic process is going to change with certain dietary patterns. So one of the things I did mention during because we had a segment during that interaction where we talked about the myths of carnivore. And I think we gave examples about fiber, and we gave examples about, your microbiome and things like that. So I won't go into those, but the one I didn't talk about was vitamin C. So we've been taught, and even in my nutrition training, there's this idea of you need a certain amount of vitamin C and other vitamins, but let's use vitamin C as an example. So the question is, where do you get vitamin C from? And most of us think about our fruits and things like that, fruits and vegetables. And that is true that the percentage of that in those items are much higher. In fact, if you look at a steak, for example, if you need 40 milligrams of vitamin C as an example, you're not going to get but 2.5 from a steak. So it's not a lot of vitamin C in a steak. First of all, you need to know that there's vitamin C in a steak. Most people don't know that. But if you eat liver, it's about 25. So you get close to whatever the recommended daily amount is if it's 40. But this is what happens in the body of a carnivore. A carnivore doesn't really need as much vitamin C. And you'll say, well, why is that true? Well, because one of the main functions of vitamin C is to help you metabolize glucose, right? So if you have a dietary pattern where you don't consume foods that turn into glucose, then you don't need as much vitamin C. So that's the first thing that happens with a carnivore. The second thing that happens is that they become more efficient at utilizing the vitamin C that they consume. So it's just that they're more efficient users of the vitamin C that they have. And so I think, this is the problem with research. When they do research studies, they may compare a diet to the standard American diet. And when you do that kind of comparison, almost any diet is better than that, right? But if you never did a study with a carnivore to see, did they actually get scurvy, which is when you become a deficient in vitamin C, they would probably find that these people don't, because a lot of these carnivores do not obviously eat plants and they don't get scurvy. So the point of this, the message I want to share with the audience tonight is, it's really important to understand it's very nuanced. And you have to use a little common sense too, right? Why do Eskimos thrive on fish and they don't eat a lot of fruits and vegetables, right? So your common sense would say there must be something to that. So the goal is not to convince everybody to be on any particular dietary pattern, but to be accepting of different dietary patterns that may help a particular individual, while also having good, honest conversation about these topics. So my goal with this reverse carnivore series is to at least move towards a model where we're all at least listening to each other. And then when you hear something that's opposite of what you believe, that you're able to say, you know what, I hadn't thought about that. Maybe I'll look into that. I actually interview a young man who has a YouTube channel, and it's called A Healthy Alternative. And we're going to talk about intermittent fasting, but this guest is actually a plant-based guest. But my point, but he also recognizes that we have to hear each other's perspective, and we can talk about it, but it's important. So I just wanted to let you guys know that that's going to be out in the summer. I'm looking forward to it. People who are on it that you may have heard of: Dr. Ken Berry, Dr. Anthony Chafee, Maria Emmerich, who writes a ton of books on low carb, and a few other people that Steak and Butter Gal, who also has a YouTube channel. So those are people that will be part of that. So I wanted to put that out there. And I think we're going to go ahead and open up to discussion. I wanted to do a shout out to Ms. Lawson for saying good evening to us. And I also want to do a shout out to Doc Habiba for being here on LinkedIn. Good to see you. And then, of course, we have Jay Harrison, who said, super interesting, and thank you all. So let's circle back. I want to go back to Dr. Johnson, and then we'll kind of open up to discussion. And if you're watching this episode, please throw any kind of medical question you have in the chat, in the comments, and we'll try to answer as many as we can. But Dr. Johnson, you know, this is a personal question. I had LASIK. I can see now. Let there be light, whatever you want to call it. And I woke up from LASIK surgery, and it was like amazing, although it was the scariest thing ever. So what's your thoughts on people considering that? My thought was contacts are not great. They have, you're putting this foreign thing in your eye. I didn't really like glasses, so I went on ahead and did it. But what's your thoughts on LASIK surgery? I'm just curious.
LASIK is a good option for a lot of people. It's not something that I push, but the technology is nice. So what LASIK is, it is where they actually take a laser and they reshape the front surface of the eye. So there's a lot of misconceptions on what LASIK is appropriate for, that they could just zap their eyes and it'll fix any problem. But it basically works best for people that are nearsighted, where the distance is really, really blurry. And so they reshape the eye so the eye light is refocused to the back of the eyes. Doesn't work as well for farsighted people. And those are people that up close, it's a lot more difficult. Now that's not the difficulty that people have when they're 40 or older. That's an age-related change called presbyopia. But for people that are young age that are highly farsighted, where their glasses make their eyes look larger, that's farsighted, and LASIK is not as good with that. LASIK is also helpful for significant amounts of astigmatism now. Astigmatism means the front of the eye is oval shaped instead of like a football or eggshell, where light is focused to two different places in the back of the eye. So there's a distortion of the light that's focused to the back of the eye. Now, you can still see fairly clearly with astigmatism, depending on how much it is, but that can also cause tremendous eye strain. One of the things that got me into optometry, when I was in undergrad, I was studying my butt off and I'd get sleepy. And I just went to the health center, something's wrong, drinking coffee. I was just getting sleepy and tired. I could not stay awake studying. So on break, I went home and I met my first African-American optometrist, who told me I had moderate amount of astigmatism. So even though I could see, blurriness wasn't an issue. I was getting tired and fatigued, and he fixed that with both contacts and with glasses. It wasn't an extremely high amount, but that made a big difference in how comfortable I could see and study. So LASIK can also help fix that. So just, again, reshaping the front surface of the eyes that refocuses light in the back of the eyes. Now, there are actually prescriptions that are too high for even LASIK to be appropriate for, because if your prescription is real high, you only have so much thickness to the front surface of the eye. You have to be careful not to make the front of the eye so fragile it could actually burst. So there's another procedure called PRK, which reshapes the eye in a different way for people with extremely higher prescriptions than what LASIK is appropriate for. The other group of people that often ask about LASIK are people that I think have fairly mild prescriptions, that their eyesight is more bothersome when they don't wear glasses. It's like, man, I have to put my glasses on to drive at night, and it's just a pain. I forget my glasses all the time, and I don't like contacts, so if you have dry eye and have difficulty with contact lenses, dry eyes can be, kind of bothersome. The other side of that with LASIK also can cause dry eyes to be worse.
Right.
So someone that does not have dry eyes, they have LASIK, and now their eyes are dry. And that's because when they reshape the eyes, they're really severing a few of the real sensitive nerves on the front surface of the eye. So your eye is not getting feedback to moisturize itself. So dry eye is a very, very common side effect of LASIK. So these things you have to weigh, and I talk to patients in depth about it, and I have people I refer to that I trust that's just not trying to do LASIK because it's a cash and carry business, just like cosmetic surgery and things of that nature. So you want to go to someone with really good integrity, with really good skills. The other thing that I explain to people, when you have LASIK, a lot of times people feel, I can have LASIK and not ever have to wear glasses again. That's really the wrong expectation. You may still need glasses for driving at night, although they do correct the eyes and the vision pretty precisely. But when you get into your 40s and you lose your ability to focus up close, you're still going to need reading glasses. You're still going to need glasses to help overcome your eyes' inability to focus up close. So LASIK does not fix that. It reshapes the front of the eyes, but we can read far away and up close. Your eyes can refocus because of that lens right behind the pupil of the eye. When you're younger, it's real soft and it changes shape like a zoom lens on a camera. And as we get older, that lens actually hardens. So that lens cannot adjust so we can see up close. And it just happens to be usually for some people in the early 40s, early to mid 40s, and some people late 40s, where that lens is so hard, it can't adjust for you to see up close anymore. And then you need a little help with the reading. So LASIK, again, for some people, I understand, because if your prescription is so strong that at night it's a safety issue, you feel unsafe and vulnerable waking up in the middle of the night, you hear a bump and you're trying to grab your glasses fall on the floor, and then what can you do? You're trying to search so you can see. So I get that. But contact lenses, again, are an option, but some people, again, with dry eye, they're just tired of the contact lenses. And if you don't mind, I can add a little bit to that. We just brought in a service in our office called Myopia Management, which some people, you're going to start hearing more and more and more about that, because when you're younger and you're a child and you get your first set of glasses at 6 years old or 5 years old, and your prescription changes year after year after year after, and it's like, oh, well, they just changed, there's nothing we can do. Well, there's a whole new field in optometry now called myopia management. It's fairly young, maybe about less than 10 years, but it's really gaining some traction where we have some tools that we can do to slow down that progression in children, so that nearsightedness can either be stabilized completely or slowed down to where our children don't have these huge prescriptions. Because that nearsightedness, even once you have LASIK, you have the eye health risks that still go along with that nearsightedness. Because what happens with extreme nearsightedness, the eye is actually elongated much more. And so you're at a higher risk for tears, holes, or detachments in the retina, macular degeneration, and a few other things. Because that retina is stretched so thin, it's a lot more fragile. So what our battle is with myopia management is to arrest and slow down that elongation of the eye that makes the retina fragile. Because again, having LASIK does not take that risk away. So you still have to have your eyes dilated periodically to make sure there's no tear or holes developed back there, and look at things like glaucoma, again, which is more common in people that are extremely nearsighted. So I just brought in a new associate, and that's her mantra, because she has very, very strong prescriptions. And she's on the fence as to having LASIK. I think she said even her prescription is so strong, LASIK may not be the best option for her. So she also has dry eyes. So she's really committed and passionate about this field, so that other young children don't have to go through that, and they don't have to get stronger and stronger prescriptions every year. So we have a lot of tools now, from drops called atropine to help relax the focusing muscles, to special glasses that we're making now, to special contact lenses that have been shown evidence-based to slow down the progression of nearsightedness, so that hopefully LASIK won't have to be as necessary for as many people as they get older.
Now, the management part, is this done with some type of exercise for your eyes? Is this medical management? What exactly are we doing with this medical management?
For myopia management,
yes,
to slow that down?
Yeah.
Vision therapy has also been shown to slow that down in people. So basically you give the eyes, the focusing system, a little bit more flexibility. So there's, like I said, there's a number of different tools that are individualized. So you can't put contact lenses on a 4 or 5-year-old. But what a lot of times are done with the younger children, they use atropine drops to help relax the focusing muscle of the eyes. On the vision therapy, eye exercise side, kids going outside more, because especially with the pandemic, kids are inside too much. So spending more time outside where they're relaxing their focus, and kids are looking far away, playing outside, and for various reasons, our children, it's just not safe in a lot of situations to do that. But any kind of activities, it could be sports, and so where they're using their eyes far away. And the other side of that, our kids, what do? We hand our kids an iPad now, which is a big pacifier. So what that does, it locks their focusing system in at a close distance. They don't get to relax looking up. They're laying down on the bed, poor posture, locked into that iPad or whatever, or computer screen or their phone. And so their eyes don't relax. And so that brings on nearsighted. We're going to see a lot more nearsightedness just from the pandemic. We're going to see big increases in that. Not only the amount, but in the amount and also the prevalence of nearsightedness. So, yeah.
I was going to ask, could you, as we're talking about this, since we have a wide age spectrum of people listening, and one of the other age spectrum is, I guess, a spectrum where, let's say this, that myself and a bunch of other folks are in right now, and that is where you end up with these things called cataracts.
Yeah.
And I know that's different than what you're talking about. So could you sort of contrast what the differences are between those, what you've been talking about, and a cataract?
Sure. Well, what I've been talking about involves that lens in the eye too. Remember, I said that lens right behind the pupil of the eye that is soft and supple, allows us to focus from one distance to the other, and then that lens slowly hardens over time. Whereas at the close distance, we can focus up, gradually moves out, and in the 40s, we generally have to wear reading glasses. Along with cataracts, cataracts is a clouding of that lens in the eye. That lens does not stay crystal clear all of our lives. And for various reasons, that lens starts getting cloudy and hazy, just like you could put cellophane tape on something, and that cellophane tape will start yellowing and discoloring. Now, what causes that hazing is the normal aging process, and I make it analogous to your hair turning gray. And that's a progression over time. And some people gray early on, some people gray later on. But that haziness develops at different paces, and it is related to our overall health also. So someone that's pre-diabetic or diabetic may get that hazing at a younger age, or it may occur more rapidly. So that hazing, technically, that's what cataract is. So it's a clouding of that lens that impedes the light coming through to the eye. You can't see it looking at somebody, and the symptoms of that may be glare at night, or more difficulty seeing at night because that light is impeding coming to the back of the eyes. And we really don't have a good treatment for early clouding of the lens in the eye, although there are people working on actually drops to help clear up cataracts, medications and holistic kind of things that can help clear. We don't have anything that's evidence-based for that yet. So the standard of care of cataracts, once it gets cloudy, I don't ever use the term that it's right. Basically, when that impediment to your vision gets to the point where I just got these glasses 6 months ago, or I just got them a year ago, and this is my best prescription, or you get new glasses, the doctor tells you have cataracts, and you get new glasses hoping that somehow this new glasses will miraculously make things a lot better, and you still have the glare, you still have time, you have to squint, your night vision is still impeded. That's when it's time to consider cataract surgery. So basically, when you can't do the things visually you're used to doing, being on a computer is bothersome, or driving at night, and that's going to be different for different people, because if you're an active senior and you're driving, you're going to meetings, you're going to church, and it's night, it's wintertime, right? So it gets dark early. You might need that cataract a lot more sooner than someone that's just sitting at home, not really even watching the TV or reading a book or things like that's just not as active. So that time to have cataract surgery, that consultation is going to be different for different people. Now, with that said, people hear the surgery word. Cataract surgery is probably the most commonly done surgical procedure in the United States. The population's getting older. It's outpatient surgery. And with advances in the cataract surgery, a skilled surgeon takes about 10 minutes to remove a cataract, where you do not have to be put under general anesthesia. You're not debilitated. You don't have to sit up in a hospital bed or sit up in your bed at home for prolonged. You can go back pretty much to normal activity the next day, except they tell you don't lift anything over 10 pounds. Don't bend over a lot, because that implant that they put in there, they replace that cloudy lens with an implant that's now clear. And boom, people the next day, they see so much brighter and lighter, and usually within a week or so, the vision's much better. Also, they don't do cataract surgery in both eyes on the same day. So they may do one eye, and then the next week they'll do the other eye, because they don't want to open up to two eyes at the same time. And speaking of opening up the eyes, you usually don't even need a stitch to close the eye up. So the little sliver that they make to remove the cataract is self-sealing. So you don't have to be put under general anesthesia. They don't have to be, and they usually just numb the eye with drops. And the technology with these implants they put in are incredible. There are also bifocal or multifocal implants that they use where people don't even need reading glasses most of the time. So just like they have both multifocal contact lenses, they have multifocal implants that certain people are good candidates for, that they can read and see in the distance. I have a couple of patients been very, very successful. Now I want to tie that into LASIK that you talked about, Dr. Tony. I just had a patient today, all her life, very strong, nearsighted person, visually impaired. And it finally got to the point where her cataracts were really kind of bothersome for her. So people with very strong prescriptions have very nearsighted or farsighted all their lives, and now it's time to remove a cataract. Their lives have changed because they've been used to having to wear glasses all the time. And this woman is just so happy she's had cataract surgery. She can see far away without glasses. She just puts them on for reading. And she's used to always having a very strong prescription. So it can be life-changing. And her question to me today was really made sense. It's like, couldn't have this been done before? Couldn't have they had done just cataract surgery on me before, remove the lens before? Well, they don't usually do that on a healthy eye. They don't do that, remove the lens and put the implant in on a healthy eye. That's just not standard of care. So, I mean, and that was a really valid question. It's like, why did I have to wait so long for this? But it's different, and it's changed. Cataract surgery, modern cataract surgery has changed a lot of people's lives, improved the quality of life. For seniors, there's studies that show that seniors prior to cataract surgery have a higher fall rate at home. And you know what falls with seniors, broken hips, things of that nature. Once you break a hip as a senior, the quality of life really diminishes. So I used to do home visits, and a lot of these seniors that were homebound, they might have been very obese or for whatever reason couldn't get up. All they needed was cataract surgery, a real simple outpatient procedure, and couldn't get it done. They'd have to literally have a ambulance come, and they were on the third floor of a brownstone. Couldn't get it done for something that, you know, is really simple in this country. So modern cataract surgery is really not something that people should fear, because it's very common, and it's outpatient surgery. You're on mute.
Yeah. You know, I just, you know, back to what he's saying in terms that I can recall at least 3 or 4 or 5 patients, you know, during the time that I was practicing. And, you know, one of the situations was a situation where lack of resources, no insurances, and so it's people with cataracts. I mean, and they were trying to function and were essentially, you know, just, you know, they were blind by cataract. And I mean, when I examine the patient and, well, you got cataracts. I mean, why is it that, you need somebody to lead you around? Why can't we fix this? And, and so when we were able to, get them taken care of, and they were just, obviously it just changed their lives. But, hopefully we don't have a lot of that now, but, back in the day when people just did not have access to the resources to get the kind of care that they need, this was a huge problem. Now, I mean, we probably have people that maybe don't go and get the necessary evaluation done. But these are things that change people's lives. That can change your life for the good or for the worse if you have it and don't get it taken care of. So that's so important. Yeah.
And thanks for pointing that out, because we're constantly faced with social determinants of health when we're dealing with our patients. I wanted to, since we're in the eye, I want to make sure Miss Lawson's question was answered. Wore glasses at the age of 8, started wearing contact lenses at the age of 30. About 5 years later, I no longer needed glasses or contact lenses. Was it the waters parting? Did God come and bless her? What happened, Doc? Is this something that you see in your practice?
Oh, I wish I could get credit for throwing some mud on people's eyes like Jesus did. I'd have them lined up. But anyway, there are a lot of things without knowing her medical history. If she's pre-diabetic or she has blood sugar fluctuations, that can change your prescription due to the shape of the lens. That can happen. Sometimes as we get older, those early cataract changes, even though it's not bad enough to where you need cataract surgery, those can change your prescription also. So just wearing the glasses was one thing. How strong was her prescription? So if it was mild or moderate, we've seen prescriptions become less. So people can get less dependent on their glasses for distance as they get older. Generally, people will get more farsighted or less nearsighted as time goes on. So if she was just mildly nearsighted, wearing contacts, and then after a while, it's like, oh, my eyes are better. But again, there are medical reasons why the lens can change and adjust the shape of your lens of your eye, so changing the focus in the back of the eyes.
Cool. And we have another question here that is from Antonio Brown. When it comes to the difference between African American kidneys and other races, when it comes to the I don't think that's extracellular fluid. I'm guessing he may be talking about the since we're talking about kidneys, the glomerular filtration rate, maybe that's what I'm guessing. So only thing I'll say about that, and I'll have my colleagues comment, is I do think that yes, there's some differences. You do tend to see a different number, a higher level of creatinine in African Americans. That's why you will see, when you look at tests, sometimes you'll see a number for, everybody but African Americans, and the number will be different, which is great because you do want to acknowledge there's a difference. When I've looked at this in the past, I couldn't really find great reasons. Some people mention muscle mass. Some people talk about, how we get rid of creatinine is going to be different for whatever reason. I'm always worried about diet and, is there differences in diet? I don't think there's enough with diet to explain that universal, concept, but I do know that there are differences. So what I think about when I see this question is research. We need to not only have research to see the differences, but then we need to live in a world that it not only acknowledges the differences, but then creates a foundation so that they can be managed differently if that's necessary. Maybe that's normal to be a little different than our colleagues or our counterparts. So I don't know if my panelists have any other thoughts. That's a very nuanced.
I mean, one of the things is that and I think the question is with African Americans and the kidney function difference. Some of this is thought to be not so much genetic as it is environmental. In other words, over time, the genetics was made to deal with certain dietary things.
Yeah.
And as people move to a different, different environment, different country from Africa to America, where the diet is different, and therefore you're eating different, therefore your kidney function is manifest in a different way. I remember being involved with a study that was being done in terms of looking at um, uh, sodium levels in different people in different ethnic group, as well as the same, African in America versus African in Africa. And as when we looked at other races of people from their, someone from their native country versus someone in America, because their dietary changes probably wasn't that different. They were able to adjust, that we did not see as higher levels of sodium, or not so much higher level of sodium, a lower level of excretion of sodium as we did in the African American. And it's thought to be due to dietary things, as opposed to a difference in the way that the kidney is made as versus DNA, but it's that adjusting, the body adjusting to diet.
Yeah. I agree. And I think that as long as we understand, I think what you're talking about is epigenetics. So how the environment affects our body. And let's be clear, we already know what the number one cause of kidney failure is. It's too much sugar floating around in your kidney. So if we can deal with this diabetes, and I'm sure my eye doctor colleague would say, I'm sure it doesn't do any good to the eyes as well. So that's why I'm so obsessed with, let's reduce the burden of glycemia, glycation, we call it, where the sugar is connecting with your cells and causing damage. Let's throw up another question that may be of interest to the group. And this is, this is from Miss Sanders. I have been experiencing migraine clusters since August. And I've never had a major headache problem, but headaches suck. I don't know if any of my panelists have had headache problems. I've had maybe 3 in my lifetime, and I don't want to have any more. So I pray for the people who have to deal with this. I have been taking Imitrex. As you know, that's a medicine that's particularly popular for that. And sometimes daily, which is a little more than what you typically see, and considering acupuncture. And just wanted to get some thoughts on kind of taking a holistic. I don't know if any of my panelists have had any experience with that modality. I know that that's not conventional medicine training. I know that in my functional medicine training, they touched on acupuncture. And what I tend to do, this is what I do as a person who has a question. I just type in migraines, acupuncture, randomized controlled trials. So that's what I would do, right? And if you type that in, my guess would be that, and that's what I want Ms. Sanders to do. My guess is that you'll probably find trials that'll show this is a benefit, but the question is how much benefit, right? Because there's also this placebo effect. Do I think acupuncture works? I absolutely do, because I've seen randomized controlled trials that actually show it works. But for this particular question, I would think that it's likely that it is going to be helpful. I also like people to have options. So when you are in a situation where you are struggling and conventional medicine has not served you, you may want to get a functional medicine doctor who can give you some alternatives, who may honor the studies that speak to holistic medicine. So that's kind of how I deal with this. But I'd be willing to bet, without the studies in front of me, to say there's probably going to give you some benefit. We do have people within our health system with Advocate Health that are holistic, that actually do acupuncture, particularly for pain, and it works. It just does. It works for headache. It works for other things. It's a bizarre thing, but it absolutely works. And in other countries, they use it all the time. I want to do a shout out to Miss Queen for.
Tony, can I just, the big thing that sort of piques my curiosity is that this problem with headaches is a something that is of recent. She says since August, and I'm a person that have had problem with migraines. Now, my migraines have not been that severe, and they're generally most of the time there's a cause for them. If I don't get adequate sleep, I'll get severe migraine. I used to drink coffee, and when I would not have coffee, I would get migraines. So caffeine withdrawal can precipitate migraines. So whether not coffee, whether it's sodas or that are caffeine containing, that you're withdrawing from that. So I think that they should make certain that there hasn't been some changes in either her diet or changes in other things that are going on in her life that may be some answers for what's going on with her and this recent onset of these severe headaches.
That's a brilliant response. And because that functional medicine training that I received always talked about ask why at least 5 times. And lack of sleep. I should have a migraine considering, living on 3 hours of sleep, stress, all of these things, some type of toxin exposure. Maybe you have something in your mouth that shouldn't be in your mouth when you got your filling. All of these things can affect you. So I think that's a brilliant response. I just found the study while you were talking that it was entitled Acupuncture for Migraine Prophylaxis, a randomized controlled trial. And this was done, I can't get the year, but the results basically said acupuncture tested appeared to have clinically minor effect on migraine prophylaxis compared with sham acupuncture. So at the end of the day, it sounds like it does impact it. And as I had guessed, maybe not as much as we'd like, but I think it'd be worth a try. It's a pretty benign treatment, to be honest with you. I think that, the risk, the reward, risk is there to try it. So I think anything that you do that's reasonably not too dangerous is probably worth considering. Now, there's another question from our.
But before you do that, before you go there, Tony, I was wondering if Dr. Maya or you give everybody a chance to jump in here. What is a migraine?
Yeah.
How is a migraine headache many other kind of headache?
Well, thank you. So I see you, Dr. Miller. Do you want to answer? Should I go ahead and then you clean it up? Because I know you got, So a migraine is when we talk about migraines, we're usually talking about headaches that can cause like severe throbbing pain or pulsing sensation. And it's usually on one side of the head. That's the official, like when we're in medical school, that's what a migraine is. What I found a migraine kind of to be is for many people that come in and say, I have a migraine, and for our community, it's usually a pattern of a series of events. They could have identified a trigger or not that results in a specific headache in a specific part of the body, in a specific part of the head that feels a specific way. Meaning, I know 5 minutes, 10 minutes before, like, oh no, here it comes. And a lot of our community call that a migraine. So I have allergies, right? When I wake up in the morning, I don't need, how they had an allergy pollen counter? I don't need that. I have an internal pollen counter that's going to tell me that day. And my process ends in a headache at the end of the day. Technically, that's not a migraine, because it doesn't pulse anything like that, right? My headache is here. But for our community, many people, if you're asking, I don't know your symptoms if you're asking, but many people have associated their pattern with necessarily a migraine. Now, what I've learned typically in migraines is there can be a series of factors: caffeine, lack of caffeine, but sugar, lack of sugar, stress, lack of stress, blinking lights, things like that trigger it and cause it. And the blood vessels change in size. You know what? It does my heart good that Dr. Miller is nodding because you're one of our I'm like, yay, back in medical school. But the blood vessels start changing in size, which cause problems for it. Now, typically, they're a group of blood vessels. That's why some people can associate their migraine with a specific spot. You know, there are a lot of treatments for migraines, giving yourself caffeine, because caffeine is going to work on the size of your blood vessels and how much blood flows, things like that. Of course, you have things like Excedrin that are going to be a mixture of anti-inflammatories and, you know, pain relievers, things like that. There are also, since we're talking about natural stuff, there's also a series that I don't know what you call it, but I'm going to look it up. There's a series of pressure points that people can go through, and without medication, and that's in studies have been shown to decrease it. The other thing about migraine, the migraine while it's happening, so going through a series of pressure points that then cause a difference in the size of your blood vessels that result in that. The other thing, so you got your medications, you can take them in the mouth, in the nose, you can do pressure points, things like that. There's also what some people take if it gets really bad and it's debilitating, it's meaning it's stopping you from working, it's stopping you from going to school, it's not stopping you from living your everyday life. They have kind of long-acting ones, a couple of them. The main one I've seen work for some people is they give you an injection, and they inject, and you're usually that's by a neurologist or a nerve doctor. They'll go ahead and inject something that usually will cause the limit in the blood vessel size, like a Botox injection, things like that. And what that does is limit the size of the vessels, meaning I get a migraine because my vessels are getting this big, it'll make it get that big. So it never gets to the size that your migraine comes on as. And so the last thing I want to say is their migraines, everybody's pattern is different. Some people smell specific smells, like, so I'm at a candy shop and I should be smelling sugar. I smell burnt rubber. And so that is just your nerves and neurons getting ready to say, hey, here it comes. And that's a pattern. Some people have, it impacts their emetic system, meaning it impacts the area the blood vessels are moving around and causing problems with the nerves that determine whether I'm going to be off balance or going to become nauseous and vomit. There's a lot of things, but what it's come to, the bottom line that I think from my community, when we talk, what I hear from community is they associate migraine with any pattern that they can identify. So if you're the person that wrote that, you do need to go to your doctor, because there's other things besides migraine. There are cluster headaches. There are other things that come about. So if you're that person that wrote it, don't forget to get connected with your primary care doctor so you can tell them the pattern and they can do other things. Because for a cluster headache, there's a different set of medication. So taking a migraine medication for a cluster headache is not necessarily going to help.
Just to add on to that, as Dr. Meyer had indicated, that in the community, oftentimes people would refer to a migraine when they got a severe headache that they couldn't make go away with the usual kinds of treatment. You know, you take an aspirin, you take Motrin, you take, things like that don't really affect the migraine headache, because the migraine is as she's saying, is due to some vascular dilatation. And so it has its own pattern, and there are sometimes what we call aura. Before they come on, people will, as she said, will sometimes smell, have a scent that's something that they smell that even though it's not there, or get tingling, get all kinds of auras that may precede the headache. And these things can be often debilitating. I've had several patients who had menstrual migraine. And so during the administration, they just could not, there was no way they could work. The headache was so severe. And some of these things along with their gynae, we would decrease the number of menses that they had, because they just couldn't work they couldn't function and we weren't able to really relieve the headaches. I mean, today we have some medication that are more effective, but that was during a time we didn't have as effective medication. And so, so oftentimes we would just treat them by decreasing the amount of time that they would have menses. So some months we'd skip the menses, therefore they would be able to do what they normally do. So these are just severe headaches that don't respond to the usual kind of treatment, because the usual treatment don't change the vessel size and change the flow of the blood.
And the treatments are not getting to the root cause of why people get sick. That's why I just shared a study that'll align with both me and Dr. Mason. Low carb diet can improve migraines. I did a podcast with Monique Travis. So remember, just search Dr. Tony Hampton, Monique Travis on YouTube. And she had Sjogren's, which is an autoimmune disease. She had migraines, and blood sugar was an issue. All of this stuff just got better when she made dietary changes. So when you become metabolically healthy and get all that inflammation out of your body, things get better. I shared a low fat study to honor my colleague that also showed improvement in migraine. So if you see, diet will fix almost anything. You can give medicines to do all of these different things, but if you fix the diet, most of the hormones in your body will normalize and you'll do just fine. So I know we're getting close to time. I wanted to quickly just respond to a couple of more questions that came through just to make sure we cover our bases. And one question was, it's kind of funny. Can large doses of injected sugar to bring the blood sugar up cause kidney failure, right? And I laugh because, we do have shots we can give people when their sugar is low. Most people just, if they're not unconscious or able to function, will be able to do okay. I will say this. I don't think that if you're just recovering from a low sugar episode, that's likely to be the outcome. That your kidneys will give you problems. However, if you live in a high sugar environment because you have uncontrolled diabetes, that is the foundation of causing 80% of all kidney failures come from uncontrolled blood sugar. So the goal is to control, reduce your blood sugar. Don't consume the foods that raise your sugar, and you'll do fine. Any other comments about Ms. King's question?
Yep, and I have.
Yeah, go ahead. The underlying issue again is, why would that person be getting injection of sugar, except for a situation where we're having fluctuating blood sugar, maybe uncontrolled diabetes, and that would be the cause of the kidney failure, would be the diabetes and being out of control. And so that's more likely to be the cause than the fact that you need to have your hypoglycemia treated.
I agree 100%. I wanted to
and the last thing I want to say, because I have to hop off, so see you next week, community, after this. Okay, what happens when we have large loads of sugar, and what the body, we got some standards, but overall, remember, if your body is having trouble processing sugar, then your large load is this much, so if you're in a large load of this. So what happens is table sugars, high fructose corn syrup, all the sugar, fructose, gets in your body. So I take my sugar, it's my bottle cap, it's my sugar, I put it in my body. The body wants to break it down and process it. It starts breaking it down into different things, purines, all this other stuff. One of the byproducts is something called uric acid. Okay. And so uric acid, a high presence of that is going to do a couple of things. It disrupts, because y'all ever seen the long line in Great America where you're trying to get on the newest ride, and then it just causes dysfunction versus a day. And so those long lines, the people are the little fructose and uric and sugar. And so it causes kind of dysfunction versus the days when the line is like clear and you get your free pass, right? And so it just goes. But the minute the load in the front is overwhelmed, dysfunction starts, okay? And so part of dysfunction, now you got a long line in front of the newest ride, meaning uric acid just sitting around. Well, it's going to be like, hey, friends, come over. And it starts to join with other minerals and things in the body, and it forms things that like our kidney stones. So to answer one of them questions in there, yes, higher sugar levels are associated with kidney stones. And, maybe for next week, higher insulin levels are also associated with kidney stones. So when I'm sitting there, I'm calling my friends on the phone, I'm telling them, come over to this ride, this is the best ride. And it really clogs it up. It clogs up the whole process, and it causes it causes kidneys, and not only your kidneys, other things to dysfunction, your liver, things like that. But when I clump with my friends and I get there and I form this, I'm oxalates, things like that. And uric oxalates, those are all minerals we can talk about. But the bottom line is when the sugar breaks down, the breakdown stuff starts to call in other things, and it forms a new molecule, and it clogs up the kidney, causes kidney stones and other things like that.
Wow, you
Thank you so much.
Go ahead and do your thing. Thank you for your thoughts, and we'll wrap up. And we'll wrap up with everybody sharing, their final thoughts for the evening. I really appreciate each and every one of you. Any final thoughts before you wrap up, Dr.
Sure.
Maya?
January is National Cervical Health Awareness Month. We got a lot of awarenesses. If you have a cervix, no matter how you identify it, it needs to get checked. It's part of your body. Check it out. Peace. Thank you.
Thank you. Okay, well, we don't have cervixes, us 5 guys, but we will wrap up with a final thought. So, Dr. Graham, what's your final thoughts for this evening for the audience?
So, all I can say is, as I've been listening to these Monday evenings, I think my attitude is to explore more. Mm-hmm. When I go to the grocery store and I see these new things that I hadn't thought about before, to explore them and to try them, because I also believe that the way to health is by eating better.
Agreed. Thank you so much, Dr. Miller.
Again, I'm going to bounce back to the thing that I talked about initially, and I want to leave that because as we're in a new year, we have to, stop looking at the problems and look for some solutions to our problems, whether they be just generally in our society, whether they be due to our health care, whatever. But let's let 2023 be a year where we begin to not be comfortable with what is killing us, but become uncomfortable with that. And because we become uncomfortable, we begin to make the changes that are necessary. If you're comfortable, you've gotten comfortable drinking, sodas, and it's bad for you, let's get uncomfortable for a little bit and let's begin to change some of these things that are killing us and start doing some things that maybe we don't like as well, understanding that we don't live to eat, but we eat to live. And we don't, and that there's some things in our lives that we want to be able to make our lives comfortable. We want to be able to not only just make our lives, but to share what we have with others, whether it be information, whether it be our assets, whatever it is that will make us as a whole. Each of us are just a part of this whole big multitude of things. And so let us not let a part be greater than the whole, but let's make the whole work better.
Love it. Dr. Johnson, any final thoughts tonight?
Our theme for our office, Bible theme, Psalms 29:19, people without vision shall perish. So we want, as Dr. Miller said, open your eyes to knowledge and new knowledge. You're never too old to change, to grow, and maybe change the vision or change the trajectory that you see your lives at. Don't be complacent with where you are. Or, this is how I am, I'll never get better, or it's too hard. Always seek to evolve and grow. And as Dr. Mason always says, food is your best medicine, and that goes for your eyes as well as the rest of the body. And just start learning some things and grow. And I think listening to this podcast, just being a part of this, I've learned so much, and it's good to get perspectives from different people. And one other thing that we share on our healthcare panel at Not-for-Profit, we find that people don't know how to engage their doctors and ask questions. Don't be afraid to ask questions of your physicians. If they don't have time to answer your questions, it's good to have them written down before you go, but that could be something, if they can't answer everything, maybe on the next visit, or either they can direct you to getting some information where you can grow yourself. So knowledge is power. One of the true powers that help your journey in good health.
Excellent. Thanks, Doc. Dr. Mason.
Yeah, we got to stop looking for, and I think this panel goes a long way in giving people more information, good information. But I think the one thing people need to understand, there are no quick fixes. There are no magic bullets, and nothing happens instantaneously, because we have been sort of reared in a society where everything happens instantaneously, or you can get it done very fast. And there are some things that do create change quickly, but realize that whatever the problem you have, you didn't get it overnight. And it's going to take more than overnight to fix it. And you're going to need to be as equally diligent with what you need to do to fix it as you did when you were breaking it. So if that means that there's some dietary changes you have to make, then you have to make them, and you have to make them forever. You can't just do this for 2 weeks or 3 weeks or feel like you get better and everything is fine. No. You've got to, we started this show talking about we have to eat to live, and we need to eat the things that help us live. And so if we do that, we'll have a much, much better life, free of more things. And stop looking, I'll leave this with you, stop looking for a miracle cure in something. There is no one thing you're going to take and everything's going to be fine. That's not going to happen. And know this, that when you start even doing the right things, it's going to take time. And if you're going to continue to get the benefit of the good things, you're going to have to take the time to continue to do them. You can do it. We all know you can. And we're prayerful that you'll get whatever strength from whatever you believe in to help you do that.
Appreciate all those words. And I know this is the time of the year where we're all kind of wrapping up and thinking about, how we can do better things. One thing I've asked my patients to do is to set a specific goal that's measurable. So instead of saying I want to lose weight, I need you to say I'm gonna lose 10 pounds, I'm gonna lose 20 pounds. Make sure you can actually achieve that. We allow 2 pounds per week, as a reasonable target. And just make sure you set a timeline. So if you're giving yourself some guardrails, it'll help you to achieve the goal. Find somebody you can be accountable with and just work on your goals. And you'll be surprised. There's so many people who are reaching their goals, doing well, but they need support. We're all kind of in it together. That's why we take time on Monday night to do this. We appreciate, Congressman Danny Davis and Nikki and Dr. Pete, who's not here tonight, just for helping to provide a platform for us to serve you. And we appreciate your engagement. I've enjoyed the questions. I know one of the questions was, how do I find an acupuncture person within Advocate? And although I think my colleague, Dr. Diana Boteri, does it, I think it's important that anybody asking that question, we just have to send it out to the referral. The insurer will tell you who you can see. So we want to go through the system so you won't find you're paying more than you should. But believe it or not, insurers are paying for these things. So we appreciate all of you guys for joining us tonight. And hopefully we'll do this again next week. And until then, everybody have a great evening, and thank you. And Happy New Year to all. Everybody have a great year. Take care.